Representative Schomacker, would you like to take up your bill, House File 316, off the table?
Yes, I'd move that we take House File 316 off the table.
Representative Schomacker moves to take House File 316 as amended off the table. All those in favor say aye.
Aye.
Opposed? The motion prevails. Representative Schomacker, would you like to move your bill, House File 316, as amended?
Yes.
We have the bill before us. Ms. Pinelli, would you please go over the amendments that have already been adopted?
Madam Chair and members, the A1-1 amendment was adopted by the committee last week with an oral amendment that was adopted, and that oral amendment was on the A1-1 amendment on lines 1.6 and 1.7. It removed the language that says employer shared responsibility payments under the Federal Affordable Care Act, Public Law 111-148, comma. The committee also adopted the A2 amendment and incorporated a change to that amendment on line 1.9. That line now should read of subdivisions 50 and 51, period. And then there was another oral amendment to the bill, House File 316, on page 4, line 16. Assessments on employers under the Affordable Care Act, semicolon, was removed from the bill.
Thank you, Ms. Pinelli. Representative Schomacker, would you like to make any comments?
Well, we had an hour and 45 minutes worth of discussion on this bill last week, and so I think everyone has a pretty good idea. But this is the nursing home rate reform bill that takes the current fee-for-service model that was started in the early 1990s and reforms it so that we're looking at more of the cost-based program in the state and trying to address things at the cost level and referring to that. So that's all I really had for introductions, and we can get on to the rest of the business.
I have an amendment labeled A3. Representative Lilly, do you want to move Amendment A3?
Yes, Madam Chair, thank you. Before we get to that, I have a quick question. At the end of the last hearing, I requested to get some runs. Were those? I didn't see those in my packet or anything. Were those provided? Because I think it's really pertinent to this entire discussion before we get to my amendment, but really for this bill as we go forward, because I think we have no idea what the impact is or what we're really fully doing. You know, I look around the table and all of our districts are different, but just what do we have any of that? I understand that some of the nursing homes around the state actually have it in their possession, so this information must exist. I just don't know why we don't have it, Mr. Chair.
Representative Schomacker.
Thank you, Madam Chair and Representative Lilly. It's my understanding that all the facilities have gotten an estimate of what they might expect to see out of this bill, but because the runs should be coming from the department and not from the industry, since the department doesn't have those runs yet, because we haven't gotten the bill in an order that's ready for them. That's the best approach, is to get the runs from the department, because that's going to be the interpretation that's going to actually be put into law instead of just estimates from the industry. And so there aren't runs for this week because we're waiting for the department to have those ready for us.
Representative Lilly.
Yeah, thank you, Madam Chair and Mr. Chair. Yeah, it just seems, I just kind of continue with my same thought. Mm-hmm. Thank you for that. I don't know if Representative Russo had a question or ready to move on. Is there, just to kind of continue, would it be possible to get these estimates? I mean, so that we could actually see, I mean, if they do exist, indeed. It was, and I'm a co-author, it would be nice to I intend to vote for the bill, I mean, but,
Thank you.
you know, hopefully it comes together and passes, because I think it's, you know, clearly needed. But I just, is there a way that we could get those, you think? Mr. Chair.
Representative Schumacher.
For today, the estimates again are just industry estimates that the facilities have gotten with that, and I don't think that's the wisest route to go when we're looking at that, just because their interpretation of what this bill does and the department's interpretation can be completely different, and passing out bad information is worse, in my opinion, than having or passing showing one interpretation of one when it's not going to be reflective of what the law will be exactly, then I don't think that's the best route to go.
Thank you, Mr. Chair. And
Representative Gunther.
Thank you, Madam Chairman. I think this bill has got a ways to go,
yes, sir.
and I know it's going to go to HH Health and Human Services Committee, and it will be fully vetted there. I think the department will have, by that time, runs that will be accepted by all. And I think because of that, we can continue to go and address this bill in this committee at this time without runs, because they will be here before the bill does pass.
Representative Levy.
Thank you, Madam Chair, and just along the same lines, I mean, I think, I think probably every member voting for this bill will probably be doing it sort of provisionally, because we don't know how it's going to impact our districts, and that can be, as more experienced members know, that can be the rub in all of this, right? But one along that line too, on page 3 of the bill, Representative Schumacher, there's this part of this is going to be the property rate system. It's going to be based on a new property rate system to be developed by the commissioner in consultation with facility providers and other stakeholders, et cetera. So there's a chunk of this bill that's kind of left for the future to be, it's sort of TBD, to be decided. And I wonder how that's going to figure into the runs that we do see, because part of this is kind of still hanging out there to be decided. Am I interpreting that correctly, Representative Schumacher?
Representative Schumacher or Ms. Thurlow, could you please tell us who you are and who you represent, please?
Thank you, Madam Chair. My name is Carrie Thurlow. I'm with Leading Age Minnesota, but here on behalf of the Long-Term Care Imperative. Representative Liebling, to your question, you're right that there is additional work being done on the property side, which is the other side of nursing facility rates. That provision will not take effect, as you can see in the bill, will not take effect until 2016. So there is another year there. But our anticipation is that as this moves through the process, as we work with the department, we hope to have additional details in additional committees to further provide additional details on that.
So,
Representative Liebling.
thank you, Madam Chair. So just to sort of finish the thought here, so before members are going to be asked to vote on this with any money attached, we're going to have that fleshed out somewhat, because even though it doesn't take effect until October 1st, 2016, that's within our biennium, so it's going to impact this next budget, presumably. And so I don't know how we can really move the bill through without knowing what that's going to look like.
Madam
Ms.
Chair.
Thurlow.
And Representative Liebling, our hope is that we will have, yes, in the policy committees, that we will have that information to have fleshed out. It certainly will influence the fiscal note, and we're well aware of that. We continue to work with the department with getting technical assistance to make sure that that's a workable system as well.
Representative Liebling.
Yeah, and Madam Chair, and just since, Ms. Thurlow, since we have you at the table, this issue about getting the runs, I mean, I get what the chair is saying. However, this bill kind of is an industry bill, at least initiated that way. And so he indicated that there may be some differences between what the nursing homes have already been told about how it might impact them and what the department may say. And for some reason, we're not getting information that our nursing homes are getting, which strikes me as a little strange. So could you comment on that? Why are they hearing the information before, or, or not at the same time that we're getting it?
I just want to remind everyone that we are going to vote at 10 o'clock, so we're going to try to do this quickly. We have 2 amendments yet. Ms. Thurlow?
Madam Chair, Representative Liebling, I'll be very brief. As Representative Schomacker indicated, the runs will come with the fiscal note that the department, we're being respectful of sort of the traditional process. The department is, as I understand, going to prepare a fiscal note that will be ready for the budget committee, which is standard operating procedure, and those runs will come from the department with that fiscal note so that you have the most up-to-date information. Even in this committee in the last hearing, there were changes made that will influence that fiscal note. As you've heard, even some of the additional work on property will influence that fiscal note. And so, we're being respectful that the department is working on that. I don't think, to clarify, we've been working with the department and getting technical assistance. We have tried to provide information to nursing homes, general estimates, so I don't think that there's necessarily a conflict. But again, in terms of the standard legislative process, we're respectful of the official fiscal note that will come.
Well, Madam Chair, just to finish up, Ms. Thurlow, I guess I just want to say I do understand the fiscal process and not having the fiscal note yet and all that's fine. But our nursing homes all have numbers with which they're lobbying us. And I think that's really unfortunate. That's not, I just want to say that. I mean, you don't need to respond, but it's, to be lobbied with numbers that we have no way of knowing where it came from or how we can confirm it. And, maybe that's not what it's really going to be. I think that's not a good process.
Representative Lilly?
Was there another question?
And no, it's your amendment.
Nope.
Thank you, Madam Chair, and Chair Schomacker, thank you for the brief discussion. There is some concerns, and I thank you for hearing them. I certainly don't want to have the strong representative from Fairmont, I think, getting a bad run on his nursing home. So I know it says that we're all held harmless, but, and you get that, I know. To the amendment, A3, we did discuss it at the last meeting briefly. It's pretty simple. That's probably why they gave it to me. No, it's 100% of the money, the pay increase would go to the staff that's taking care of our seniors and our disabled folks, which we talked about quite a bit in the last hearing. The providers talk about it in their goals of the continued staffing problems that they're having, and obviously, I mean, it's pretty basic principle with employment. If you pay people well, you're going to have less turnover. We had these great testifiers, or this morning again from the university with staffing problems they're talking about, and then quality of service. I mean, the medication. Just think about the medication that they're giving to folks, and if the person knows. Going back to Helen, if they know Helen, and she's pretty cute, isn't she, Bobby? So she's, so if they know her, we're going to be able to keep good folks and to reduce the turnover. As you guys vote, I am going to ask for a roll call, and the reason is because I think we should be accountable. These folks live in our district. If you look around the room, there's some. In my mind, there's some big money that is behind the care providers, but, these aren't the folks that live in our districts. I mean, yeah, you're going to have a few administrators, but really the people that are the cooks, the cleaners, that are really the people, that are offering this quality care. I mean, that's clearly a big weak spot, just a sidetrack in this bill where we have different work groups that are being treated differently, and I hope we deal with that as we go through too, because that's just really, it's just not really the right way to do it. But my intent is to have folks treated fairly, treated well, and to ensure that the seniors, again, Helen, is getting quality. I can't use props on the floor, so I'm teaching you freshmen a trick here. So, but we can do that here, sort of. But, you know, that the money goes to the folks that really make a difference and ensure that we have quality care. So that's what the bill or the amendment's trying to do. And I've heard from folks that it's workable. That this money, if we were to do it this way, I've heard from the state and others that it would work, because there is, it's a reasonable number as well, that there's, when you look at it, there's costs related to employees, that would be off of that, so if, if there's healthcare costs or other costs. So, but anyways, the intent is to try to pay people well and to maintain quality service. So that's my amendment, A3. Like your vote.
Representative Lilly requests a roll call. There'll be a roll call. Any further discussion on the amendment? If not, the clerk will take the roll. Oh, I'm sorry, Representative Schomacker.
The chair votes aye.
Thank you, Madam Chair. I would ask members to unfortunately oppose this amendment. I understand what Representative Lilly is doing and think that he's doing the right work with it, and I know that his heart's in the right place, but when we look at especially the 100% encumbrance, and I've spent a lot of time too this week talking to different folks who know a lot more about encumbrance than what I ever wanted to, and now I know that information too. But when, last week when we were talking about how there might be a workable solution in this, I got tripped up in that mindset that this was a COLA bill, that this was just a rate increase for everyone, and that's not the case. This is a reform bill that's going to be looking at the cost basis of things instead of the fee-for-service model that we have been under. And so at this point, I don't think that the encumbrance will work, especially at the 100% amount, because there are other costs that are associated with nursing facilities, including the heating and cooling of a facility and laundry and food and the whole gamut of things that would not be allowed to have any cost base to pay for that under this amendment. And so, members, I would ask you to vote no.
If not, the clerk will take the roll. Representative Uruso.
Thank you, Madam Chair. Very briefly, I would encourage a yes vote because all of our testimony was about the need to do employee retention. I've visited with the people in the biggest facility I have in my district, and that's their main concern, their one and only concern they voiced. I've gotten a lot of letters from people. We had an increase in the previous biennium to help take care of some of the other costs, but what we're still hearing is it's not getting down to the employees, and that's that retention and consistency is my constituents' concern.
Okay, the clerk will take the roll.
Schomacker,
No.
Tice,
No.
Baker, Christensen,
No.
Considine, Daniels, Franzen,
No.
Gunther,
No.
Keel,
No.
Liebling,
Yes.
Lilly,
Yes.
Mason,
Yes.
Miller,
No.
Newton,
Yes.
Rosenthal,
Yes.
Uruso.
Yes.
There being 6 ayes and 7 noes, the motion does not prevail. Representative, I have an amendment labeled A4. Representative Newton, do you want to move A4, or A4? There
Yes,
was a
Madam
typo.
Chair, I'd like to move the A4 amendment. This amendment very simply provides for an annual cost of living for nursing home employees. And first, Representative Schomacker, I want to thank you for bringing this bill forward. I think this is a change that's dramatically needed, and we're moving in the right direction. But also with the annual cost of living adjustment mandated, that would be a factor that would be built into your cost as you move forward with this. And you know, I don't want to play politics with this, and, but Representative Baker was talking about how he was embarrassed because we didn't do much in the past on this. We did do a lot in the last session, but I think this will continue to move us forward to make sure that our nursing home employees are paid fairly and across the board that the increase happens. I carried the 5% bills in the last session, and what I found, one of the things that happened was that not all of the money that went for salaries was apportioned equally. And this would ensure that everyone has adequate apportionment of the funding. So with that, Mr. Chair and Madam Chair, I'd like to again renew my motion to move the A4 amendment and call for a roll call.
Representative Newton moves Amendment A4. Does everyone have the amendment? I'm not sure I asked that. Is there any further discussion?
Madam Chair?
Representative Schomacker?
I appreciate what Representative Newton is doing here. I think that he's doing it for the right reasons, but again, for the same reasons that I asked for a no vote on the encumbrance bill. This is a reform bill and not a COLA bill. I don't see exactly how this works into the current framing of the bill. I know what you're trying to do. I think it's a good idea, but there's no money. The way this is framed, there's no money to back it up. And so if there are lean years in the government that there isn't a rate increase down the road, and there is this mandate to do the inflationary increase, that's going to put a crunch again on our facilities. And what that means for them is they're going to have to do these increases because of this mandate, but are going to have to cut somewhere else. And I don't think that's really what our intent is or what we want to do. So I'd ask for a no vote.
Representative Mason?
Thank you, Madam Chair. For years, we've watched the facilities struggle and the staff struggle because we haven't been paying them appropriately. I mean, we need to be drawing a line someplace. And we're doing the reform. This, to me, is the place.
Representative Schomacker?
No, that's
No comment?
Madam Chair.
Representative Newton?
Thank you, Madam Chair. And to Representative Schumacker's point, if you know that the cost of living increase is going to be automatic, that would be built into your cost-based program. So that would be, you know, a part of the way that it's calculated annually. And that's the point that I'm trying to make, is this automatically would be a part of the program.
Representative Schomacker? No. Nothing? Representative Newton requests a roll call. There will be a roll call. The clerk will take the roll.
Schomacker,
no.
Tice,
No.
Lilly,
Lily? Aye.
Baker, Christensen,
No.
Considine,
Yes.
Daniels, Franzen,
No.
Gunther,
No.
Keel,
No.
Liebling,
Yes.
Mason,
Yes.
Miller, No. Newton,
Yes.
Rosenthal,
Aye.
Uruso.
Yes.
There being 7 ayes and 7 nays, the motion does not prevail. Representative Schomacker, do you have anyone that would like to testify on the bill?
Seeing as we have a minute and a half, Madam Chair.
I know. Is there anyone in the audience who would like to testify on House File 316? I am not aware of any other amendments to House File 316. Is there any further discussion of the bill as amended? And remember, we only have minutes. Representative Newton?
Madam Chair, I'll be very brief. Because this bill now moves to the HHS Policy and Finance Committees, will we have a chance to see it again? You know, to get these figures that we all have been talking about so that we know globally what the total cost will be, and then individually how it'll affect our individual nursing homes.
Madam Chair,
Representative Schumacher.
When the department has those ready, we'll definitely get those out.
And it will not most likely come back to this committee, but we will be able to get the runs to you when they're available.
Thank you.
I'm not aware of any other amendments to House File 316. Is there any further discussion? Again, you got like 30 seconds, if that. Hearing none, Representative Schomacker renews his motion
Roll call.
that House File 316
Madam-
as amended.
Madam
Oh, I'm
Chair?
sorry, Representative Lilly.
I'm sorry, just real quickly, Chair Schumacher, thank you for the discussion, and I hope you do consider, as it moves forward, some sort of way that we can retain staff. I mean, it really is indeed a problem, and we all know it, and it's just a matter of figuring it out, of course, but please figure out a way to do that and get the runs. This is an aging committee, and I know it's not really, a finance committee, but it's really, our primary work is this bill. I think, our problem that we're having statewide. So I'm glad you're moving it forward, but it's really the work and staffing is, part of it. But I would like a roll call on the bill, please, Mr.
Madam Chair.
Representative Rosenthal.
Thank you, Madam Chair, and Representative Schumacher, thank you for bringing this bill forward. In the past 2 bienniums, we've seen 2 things. We've seen investment in nursing homes in the last biennium, and the biennium before that, we've seen dramatic cuts, which I believe you voted for, and I won't hold it against you. But there is a part, getting back to Representative Liebling's questions about the property rate system. That seems to me to be a policy decision, and we should be discussing it in this committee. And while I appreciate what you're doing, and I think all of us around this table sympathize with the intent of the bill, and we want to see it succeed, and we want to see you succeed going forward. So I would ask that we see in this committee the process for which these property assessments are going to be made. And we see also not only the runs, but all of this may have finance connected to it, but all of it is also policy. And we should see that in this committee. And thank you again for bringing the bill forward. And Madam Chair, that's all I have to say.
Thank you. Representative Schumacher renews his motion that House File 316, as amended, be recommended to be re-referred to the Committee on Health and Human Services Reform. Representative Lilly requests a roll call. There will be a roll call. The clerk will take the roll.
Schumacher,
Aye.
Tice,
Aye.
Lilly,
Yes.
Baker,
Yes.
Christensen,
Yes.
Considine,
Aye.
Daniels. Yes. Bronson,
Yes.
Gunther,
Yes?
Keel,
Yes.
Liebling,
Yes.
Mason,
Yes.
Miller,
Yes.
Newton,
Yes.
Rosenthal,
Yes.
Urusso.
Yes.
There being 16 ayes and 0 nays, the motion prevails. House File 316 as amended is recommended to be re-referred to the Committee on Health and Human Services Reform. Meeting is adjourned.